In 2000, I started to get exposed for a personal reason on hyperbaric oxygen therapy. And the biggest problem if an individual wants to do that, going to a hospital setting is extremely expensive. And sometimes you can't even get it, even if you had the cash. And so that's why in 2006 we brought in the hyperbaric oxygen therapy as part of the solution to, or in addition to, the other therapies that we were doing. The main thing to remember about hyperbaric oxygen therapy, lots of people think it's just the oxygen. The benefits of hyperbaric oxygen therapy has to do with oxygen for sure. It also has to do with pressure. And actually, I guess third, it does release your own stem cells. So if you look at the studies, especially the one from University of Pennsylvania, shows that if you have hyperbaric oxygen therapy, you will have an increase in stem cells circulating in your body, which then indirectly can help you heal. It also releases a particular signal in our body that helps us heal. And so it's not just the oxygen. So we have to be careful that not all hyperbaric oxygen therapy is the same. I'm very excited to have a hyperbaric chamber that is big enough to actually sit 6 people. Some of the big hospitals may have a big chamber, but in clinics, there's not that many that have a chamber our size, where you can actually just walk in, stand up. You can have a companion in there if needed. We sometimes put a nurse in there that can be with you. So we have multiple options. So I'm excited about having a chamber that is not small, that patients can have either a spouse, a nurse. They don't have to be, if they're claustrophobic, they usually can do just fine. Is technically bigger than MRIs. People know what that looks like. That is very small. This is nothing like that.
I've seen people get their lives back. I watch as patients come in, they're usually very discouraged, and they're just discouraged, and many of them have given up hope. And the improvements we see in the chamber, so much of the time it's so subtle to start with that our patients think they're imagining it at first, and then it's just undeniable. I was telling Mila, I watch them every day when they come in, and I see them just start to stand up a little straighter, maybe have a little more smile on their face, start to wear a little brighter clothing. Because our treatments last 40 days, so we're looking at 8 weeks in a process, and you just see them open up like little flowers, children especially, and adults too.